Hi everyone, my name is Dinesh Sarasena and I'm a consultant in sports medicine. I use ultrasound regularly in my clinical practice and I'm here to share with you some of the things I've learned along the way. In my last video, I shared about the overall equipment that you require for ultrasound guided interventions. And here in this video, I'm going to share a little bit more specifically about what you require for the injections. So this is the overall equipment required, and some of you may recognize this from the previous video. There's obviously the ultrasound machine itself, the treatment table, and on the bed we have the other equipment required for the injections itself. So let's have a little bit more of a closer look at this now. So let's deal with preparation first. It's useful to have iodine or chlorhexidine for cleaning the skin. Sterile materials such as your gauze, your cotton balls, your sterile gloves, and your dressing pack, which will provide you with your sterile field. And finally, it's useful to have an absorbent sheet. This reduces and minimizes the mess that might be associated with the procedure, such as that from the cleaning solution or maybe even from blood. And in doing so, hopefully it minimizes the distress to the patient. Next, as part of our preparation, it's useful to get these things ready. We have our sterile gel, which is important to maintain sterility of the procedure. A pen, marker pen to mark out the area, particularly if you're doing pre-scanning, such as with spine injections. A sterile drape, and for this you may need to cut it down to size. So having sterile scissors is also useful. And also the sterile transducer cover. Again, to maintain the sterility of the procedure, and it's useful to make sure that you have one that's appropriate to the size of the transducer you're going to be using. Then, for the injections, we have a variety of different equipment as well. The syringes, obviously depending on the volume required. So for small procedures you may require the 3 mils, and for larger procedures you may require the 20 mils, such as with aspirations. Generally, I recommend the 10 mils if you're going to be doing high volume or hydrodilatation procedures, because although you have to change the syringe more often, it's easier to push through. The needle will also depend on the depth of the injection that you're going to be doing. So for hydrodilatations and hip injections, I tend to use the spinal needle because it's a little bit stiffer, and also once you remove the trocar, the bore is quite large. In contrast, for more superficial injections such as carpal tunnels, you may consider a 25 or a 27 gauge needle. In addition, there's other equipment here, including the 3-way tap, which is useful for mixing up things like prolotherapy, the reverse vacutainer, which is useful for PRP, the extension tubing, particularly if you're having to change the syringe multiple times, such as with a hydrodilatation, and lastly, the tourniquet and alcohol wipes when you're obtaining the blood for the PRP injections. Some of you may recognize this from a previous talk that I gave about the various types of injections available. I've included it here because it's important to know what you are injecting. So it could be the hyaluronic acid, steroid, such as the dexamethasone or triamcinolone. I've included the PRP vacutainers here as well, because although it's not a treatment it's not a medication, it's something that you're going to be required to use to prepare and obtain the blood for the PRP. There's saline, dextrose 50%, and lidocaine as well. Finally, we come on to post-procedure. It's important to make sure that the patient is given adequate advice, and you also need to have things prepared, whether it's just to apply simple dressings, to apply compression, to send samples, such as with joint aspirates. And it's also important to clean down your clinical area, such as with the Hospicare 70. And this is particularly important these days when we're talking about infection control and COVID prevention measures. Well, I hope you enjoyed the video and it adds to your knowledge about ultrasound guided imaging and procedures. I hope that you can take some of this away and apply it to your own clinical practice. If you did like the video, please remember to hit the like button down below, and if you want further updates, please follow the channel. You can also follow me on Instagram and Twitter. I hope to see you all very soon. Take care.